Mr. Speaker, first let me thank my colleague Congresswoman Marcia Fudge of Ohio for leading this special order not only tonight but each and every Monday night to keep our caucus and the country focused on addressing the key issues which are looming today. She consistently and is constantly on the case, making sure that we speak with one voice on the very, very critical issues which our country and the world is facing. So thank you, Congresswoman Fudge, for your leadership. As chair of the Congressional Black Caucus, I join my colleagues tonight in this very timely discussion of health care and our efforts. And also I want to make the case tonight for prevention as a very cost-effective strategy for health care reform. Prevention and, of course, public health should be the cornerstone of any true health care package. Prevention that takes place outside of the doctor's office can be just as important to impacting the health of Americans as health care on the back end when one ends up in the emergency rooms. Disease prevention is universally popular from coast to coast and across political spectrums. Americans understand and appreciate the value of prevention, the value especially for reducing disease rates, for improving the quality of life, and for lowering health care costs. And yes, given the rise in deficit, we all are extremely concerned about the cost of health care. But we also must remember that an ounce of prevention is worth a pound of cure. But for whatever reasons, those experts who are giving us the numbers in terms of the cost don't seem to, for whatever reason, want to tell us how much we will save based on prevention as a key element and strategy in our bill. In a new poll released last month by the Trust for America's Health, Americans actually ranked prevention as the most important health care reform priority. The poll also found that more than 3/4 of Americans believe the country should invest more in keeping people healthier. And by a ratio of nearly 4-to-1, they support putting more emphasis on preventing disease rather than treating people after they become sick. People are convinced it will save the healthcare system money. But surprisingly, the poll also found that more than 70% of Americans say investing in prevention is worth it, even if it didn't save money, because it will prevent disease and save lives. But we also know that it will save money. Now, this is not about lecturing people about behavior, but instead what we want to do is remove barriers to good health that are beyond the control of most people. One role of government in health care is to provide opportunities to make it easier for people to make healthy choices. Americans are not as healthy as they could or should be, and this is resulting in skyrocketing health care costs that threaten to bankrupt American businesses. And our workforce is less productive than it could be or it should be as it relates to competing with the rest of the world. Tens of millions of Americans suffer every day, from preventable illnesses like diabetes, heart disease, some forms of cancer and infectious diseases, which rob them of health and the quality of life that they deserve, and also drives up health care costs. More than half of Americans suffer from at least one chronic disease. 2/3 of Americans are obese or overweight, and 20% of Americans smoke. Due to the epidemic of obesity, today's children could be the first generation to live shorter, less healthy lives than their parents. This is very scary. The nation's economic future demands that we find ways to reduce health care costs. Helping Americans stay healthier is one of the most effective ways to lower costs and to ensure that our workforce is strong and productive enough to compete in our global economy. According to the United States Centers for Disease Control and Prevention, a vast majority of chronic diseases could be prevented through lifestyle and environmental changes. For too long, the healthcare system has focused on treating people after they become sick instead of keeping them healthy in the first place. We need to shift from a sick care system to a health care system. Prevention can improve the quality of lives of Americans, spare millions from needless suffering, and eliminate billions of dollars of unnecessary health care costs. Research shows that strategic investments in disease prevention programs in communities can result in a big payoff in a short time, reducing health care costs, increasing the productivity of the nation's workforce, and helping people lead healthier lives. Let me just conclude by saying I have to take a moment to commend Congresswoman Donna Christensen and the Congressional Black Caucus's Health Task Force, along with the Congressional Hispanic and Asian Pacific American Caucus Task Forces, for their diligent and effective work to ensure that any health care reform bill includes a real public health option and provisions to address the racial and ethnic disparities with which we face each and every day. Unfortunately, people of color are disproportionately seen in emergency rooms because they don't have health insurance and can't get preventive care. For example, African Americans are 3.5 times more likely than whites to get an amputation as a result of diabetes. African American men with colon cancer are more than 40% likely than white men with the same condition to receive major diagnostic and treatment procedures too late. So, Mr. Speaker, as we debate health care reform, let's look at the real costs and focus on the billions, and I mean billions of dollars, that we will save if we remember that old adage that an ounce of prevention is worth a pound of cure. Thank you, Congresswoman Fudge, for your leadership and for giving me a few moments to talk about this very important issue tonight.
Thank you very much.